Welcome, everyone. In today's calm and focused session, we will explore the MRI of the parotid gland, a small yet significant gland that supports every smile, every conversation, and every bite we take. MRI opens a clear window into this delicate structure, revealing details that no other imaging can show. Let's begin this elegant journey into head and neck imaging. The parotid glands sit gently on both sides of the face, just in front of the ears and along the jawline. They are the largest salivary glands, responsible for producing saliva that softens food and aids digestion. When there is swelling, infection, obstruction by a stone, or a tumor, even a small change can alter the symmetry of the face or cause noticeable discomfort. To understand these changes clearly and accurately, MRI is the safest and most precise imaging tool. Why MRI for the parotid gland? The parotid region contains complex soft tissues, and MRI is uniquely suited to reveal them in detail. MRI provides excellent soft tissue contrast, clear visualization of deep lobe involvement, precise assessment of facial nerve displacement or invasion, clear distinction between cystic and solid lesions, characteristic enhancement patterns for tumor evaluation, accurate detection of perineural spread, especially in malignancies. In simple terms, MRI doesn't just show the gland, it tells the entire story. Patient positioning. The patient lies comfortably in the supine position. A soft headrest is placed to keep the head steady, and the neck is kept straight. No rotation, no tilt. A head and neck coil or dedicated neck coil is used for optimal image quality. The technologist gently instructs the patient, "Please keep your head still." Even small movements can blur the images. This calm preparation ensures a crisp, high-quality MRI scan. Essential MRI sequences. A high-quality parotid MRI includes a combination of beautifully complementary sequences: STAR with T1-weighted images, T2 with fat suppression, STIR or SPAIR, T1 fat-saturated post-contrast, and diffusion-weighted imaging. Together, these sequences create a complete and accurate diagnostic picture.